hijamah bed we use. You see, the specialized hijamah bed, people will actually put their head so you can breathe. So you can put your head there. Okay, you can breathe out there. So that's the specialized hijamah bed. Now, the next thing is that we want to mop up and clean up his back. Okay, so you see, we go into our swab there and give him a clean, sterile clean. You see, we mop up all the back. We mop up the back. We mop it up. Then we sterile. And make sure that. And now this is a fast drying. It's like mentholated spirit, so it dries off fast and also takes the place. And also do this mopping very, very well. We discard it in a bin. Do more mopping. Also clean up everything. Clean up all points. And make sure that there is no evidence of any bacteria. And if you mop it up, you find out that the cotton wool itself is a bit dirty. That signifies that you've taken out so many of those things. So let's go into the hijamah proper. Now when you're doing hijamah, this is a significant point. Okay, this is a significant point here. This is signifies when we got 1 or 50, it is the blood-brain barrier. It plays a significant role when you talk about hypertension or anything. This is where all the blood flows to the brain. Now, for this kind of hijamah, we're doing it here. You can see you put the cups in like that. You put it on the skin and look at it. Go closer, go closer. You see when we pump it, you can see the skin coming up. You can see the skin coming up. Now, you see there are basically 3 points now. You see the skin coming up? Okay. Are you okay?
Yeah.
You okay? Okay. So you see the skin. Now, the next thing is, since you have these things here, you have to time them. Basically, you could use 5 minutes. So we use 5 minutes. What happens is that this suction here represents the fact that we are getting an osmotic pressure on the bad blood. It's coming to the surface. And remember, before you do hijamah, your patient's stomach has to be empty. At least for 3 or 4 hours, that person has not eaten. You don't need to be starving, but you need to be okay to do the hijamah. You can pause it.